Well, it is the news that nobody wants to hear. You or a loved one has been diagnosed with cancer. You know, your heart sinks, you're devastated, but the good news is there's hope out there because there are so many great treatments here in this city. And Dr. Roy Dagan is part of the team here at the University of Florida Health Proton Therapy Institute. Thanks so much for taking time out of your day to talk with us.
My pleasure. Thank you for having me.
So I think when people think head and neck cancer, their first thought is brain cancer, but head and neck cancer is something completely different.
Correct. In fact, it's not just one disease, but these are cancers that can occur anywhere in the head and neck region, predominantly in the mouth and throat, but also in the voice box, the thyroid glands, salivary glands. Even the skin of the head and neck has its own unique cancers. So it's a complicated group of diseases, but certainly one where we've seen a lot of progress in terms of management and improving outcomes and better survivorship in those who are fortunate enough to live through their cancer diagnosis.
Which is the hope everyone has when they come here and they see someone like you and they come for this type of treatment. And in fact, April is Head and Neck Cancer Awareness Month. So let's talk about, I think the most important thing people would want to know is, how do you get ahead of this? How do you prevent head and neck cancer?
Right, so that's often the best way to manage these, is to never have to deal with them. There are no widely accepted screening guidelines, but there are certainly things that individuals can do to avoid getting these cancers. Most of them have been related to excessive tobacco exposure and alcohol consumption. So anything you can do to change those habits or eliminate those habits from your life will help you prevent these diseases.
Really, I figured kind of smoking and tobacco products was kind of an obvious one, but alcohol as well?
Alcohol as well, and even more recently, cancers, especially in younger patients, that have nothing to do with tobacco and alcohol consumption. It turns out that the HPV virus, human papilloma virus, the same virus that causes cervical cancer in women, is now responsible for 60 to 70% of all new diagnoses of throat cancers. The good news here is that these cancers have a much better prognosis than the ones that are related to tobacco, but the other good news is that we have effective ways to eliminate these through vaccination. It's important to vaccinate early because this virus is transmitted through intimate exposure, and so the earlier we can vaccinate our children, typically around ages 11 and 12, the better chance we have of preventing both cervix cancer and a huge proportion of head and neck cancers.
Now, you kind of touched on that there aren't a lot of screening techniques available today, but when we're talking particularly about that type of throat cancer, is there something that maybe when you're going to the dentist or when you're going to your regular doctor that they can participate and offer some type of screening method for you?
That's right. In fact, most dentists nowadays are doing an excellent job of screening for oral and throat cancers during routine dental examination. And so I would advise patients and individuals to ask their dentist if they're doing that type of examination and to encourage them to do so, because they can pick up on early stage new cancers, and the treatment will be much more effective when it's caught early, and also preventing the devastating side effects of treatment can be much better in those situations when we've caught it early. In fact, many patients with early stage oral cancers can avoid radiation altogether, but if it's missed or they don't present to a medical facility early, then they're often facing major surgeries, radiation, chemotherapy, all of which can have a devastating effect on almost every aspect of our life, the way we eat, the way we speak. So these are particularly challenging cancers, not just from a treatment perspective, but from a survivorship perspective.
Well, let's talk about treatment with the proton therapy and how you can minimize some of those damaging effects of the treatment itself.
That's right. So we're using proton therapies really with two goals. There are certain diseases within the head and neck where we've really had a challenging time obtaining disease control, and it turns out that the local disease control will matter more for head and neck cancers than many other diagnoses. Unlike other tumors, these cancers tend to not spread. So most patients who will die from head and neck cancer will die because we haven't been able to control it right where it started. Traditionally speaking, in things like sinus cancer, we've had a really hard time using aggressive surgery and conventional radiation. These cancers often are quite advanced when they're diagnosed. They will often invade skull-based structures around the eyes and the brainstem and the brain, and it makes it very difficult to cut these out surgically or deliver aggressive radiation. Now, with the advantages of proton therapy, the ability to more elegantly deliver the dose distribution to the target and avoid things like the eyes, the brainstem, we've been able to really intensify the treatment and to improve the chances of disease control. Historically, we were pretty happy if we got 60% control of these cancers, and nowadays, after good surgery and proton radiation, we're able to control 90% of these tumors. So it's been a major improvement from that perspective. In many other cancers, the goal is to limit the difficult side effects from treatment. So most patients who undergo a course of head and neck cancer radiation will suffer significant dry mouth, loss of taste, difficulty swallowing. They'll often require a feeding tube just to maintain adequate nutrition. And we can really help them by decreasing the dose to the normal tissues that are not involved with cancers, in particular parts of their mouth that are not involved, their salivary glands, and also the muscles that are involved in swallowing function. And we've seen, especially with newer applications of proton technology, that we can really make a difference in those organs. And so the goal in diseases like throat cancer is to not necessarily improve the chances of surviving, but to minimize the impact from treatment.
Well, Dr. Dagan, thank you so much for joining us today, especially as it is April Head and Neck Cancer Awareness Month. Great information that you have provided, especially about the treatments offered here. Thank you so much for taking the time today. And of course, we would like to thank the University of Florida Health Proton Therapy Institute for sponsoring this segment. And for more information, you can visit floridaproton.org or give them a call at 904-588-1436.